Welcome to this Clinical Explainer. Today, we're zeroing in entirely on Emisset, specifically the Ondansetron 4 mg injection from Cipla. Look, if you're out there on the front lines of patient care, you already know that managing a patient's GI distress isn't just important, it's an urgent, drop-everything kind of priority. So, this briefing is built to give you exactly what you need to safely and effectively assess, administer, and monitor the specific medication on your floor.
We're going to mirror your actual clinical workflow today. We'll quickly run through the mechanism of Ondansetron, the primary clinical indications, IV versus IM administration, monitoring common side effects, and finally, contraindications and drug interactions. Let's get right into it. Section 1. The mechanism of Ondansetron. Understanding exactly what this med does under the hood is key to knowing why we use it.
Okay, starting with the absolute basics. Every standard ampule of Emisset you pull from the pharmacy contains exactly 4 milligrams of the active ingredient, Ondansetron. Getting that standard unit locked in your head is step one for your protocol, ensuring your pull perfectly matches the physician's orders.
So what is this drug, really? Well, it's a targeted antiemetic. Its one and only job is to provide your patient with immediate, powerful relief from severe nausea and vomiting. It's basically a highly specialized tool in your clinical tool belt.
The way it works is actually pretty fascinating. Picture this. When a patient goes through trauma or specific intense treatments, their body naturally releases serotonin, and it's that serotonin that hits the trigger for nausea and vomiting. Ondansetron comes in and aggressively blocks those exact serotonin receptors. It literally cuts the communication line, and boom, the nausea is halted.
Section 2. Primary clinical indications. Knowing the mechanism is great, but application is what really matters. Let's talk about when you're actually going to reach for this.
You're going to see amazing results in 3 main scenarios. First, chemotherapy. We all know the nausea there can be absolutely debilitating. Second, it's a lifesaver for patients dealing with radiotherapy-induced distress. And third, postoperative care. Seriously, the very last thing someone needs after major surgery is the physical strain of throwing up. In all these cases, Ondansetron is a total game changer for getting them immediate relief.
Section 3. IV versus IM administration. Now that we know when to use it, let's talk delivery.
You've got 2 main routes here, intravenous or intramuscular. And honestly, the difference for your workflow is huge. IV acts incredibly fast because it's going straight into the bloodstream. IM, on the other hand, has a distinctly delayed reaction time. When someone is actively in severe distress, the route you pick changes everything about how long they have to suffer.
Keep this specific time frame locked in, 10 to 15 minutes. That's your window for IV efficacy. You know as well as I do that when a patient is actively sick, 15 minutes can feel like an absolute eternity. Pushing at IV prioritizes the fastest possible relief.
Section 4. Monitoring common side effects. Because giving the med is only half the job, right? Your workflow immediately shifts to vigilant post-administration monitoring.
Ondansetron works wonders, but you've got to stay vigilant. Watch the injection site for localized pain. On the GI front, things can actually swing either way. They might hit constipation or diarrhea. Systemically, you need to be hyper-aware of the onset of severe fatigue. These are the most common reactions we see in the clinical data. The big takeaway here, patient fatigue and constipation aren't just minor complaints you nod at. They are specific, actionable monitoring prompts. When you're doing your check-ins, actively asking about their energy levels and tracking bowel movements absolutely needs to be part of your charting. Section 5. Contraindications and drug interactions. Knowing when to use a medication is important, but knowing when to avoid it is what literally saves lives.
If you spot any of these on a chart, hit the brakes. Do not administer. Obviously, a known allergy to Ondansetron is a full stop. But also, if the patient suffers from Parkinson's disease, that is a massive contraindication. And you've got to check their current pain meds. Concurrent use of specific opioids, specifically morphine or codeine, absolutely contraindicated.
I really can't emphasize this protocol enough. As frontline nursing staff, you are the last line of defense. Taking those extra 10 seconds to verify opioid interactions, specifically catching that morphine or codeine on the chart before you draw that medication, is vital to patient safety.
A quick administrative aside before we finish up. When it comes to pharmacy stocking, these 4 milligram ampules are highly accessible. They usually run between 20 and 22 rupees each.
It's an incredibly affordable intervention that provides massive quality of life improvements for patients in distress.
So as you head out to your clinical floor today, I want to leave you with one critical thought. Before you administer your next antiemetic, have you thoroughly checked your patient's chart for opioid interactions? Make it a rock-solid habit. It ensures safe, effective care every single time. Thanks for hanging out with me for this clinical